Okay, today we're going to discuss the other blood group system. So we have discussed already the ABO and the RH blood group system. So for our other major blood group systems, so we need also to discuss them because basically they tend also to be affecting here the outcome of our compatibility testing. So again, if the donor recipient will not be compatible with the blood group antigens and antibody with the other blood group system that we're going to discuss today, that would eventually also result here to our hemolytic transfusion reaction, especially if the antibody related to that blood group is an IgG antibody, which is a clinically significant antibody. So to start here with your MNSSU blood group system. So this blood group system has been assigned here by ISBT number of 002. So first we have here so your MN are antithetical partner to one another. So, mean to say always magkasama sila. Then we have also the SS, the bigger S, smaller s, and the U blood group system are also antithetical partner to one another. The bigger S and smaller s, and also closely linked with that, with the S and the S here would be the U blood group system. So we start with your M and the N. So the M and the N blood group system, so basically that one would be found here in the outer membrane RBC, primarily in your GPA or your glycophorin A. So glycophorin A is the outer membrane structure of the RBC, and therefore, so we will able to understand that with the action of your routine blood banking enzymes, since nasa outer membrane makikita ito, they are usually destroyed by our enzyme treatment. Okay, so again, your M the M are antithetical partner to one another. So this blood group here, the M the N, differ with one another with their amino acid position number 1 and amino acid position number 5. For the M, the amino acid position number 1 is your serine, whereas your N, the position number 1 amino acid is made up of the leucine. In our position number 5 na amino acid naman, it is also differ. On which your M blood group system would have here your glutamine as the amino acid position number 5, and we have also here your glutamic acid for the N blood group system. Okay, so we have here the antigens. Antigens related to both your M and N na blood group system. So they are well developed at birth na antigens. So usually they are being produced as early as 9 weeks. Okay, since again they are found in the outer membrane, so they are usually destroyed here by our enzyme treatment. Okay, this antigen could be found only in our blood cell in the form of the RBC. So, nasa RBC lang natin siya na membrane makikita na blood cells natin. They could not be found in other blood cells or body, like for example, your lymphocyte, granulocytes, or even your monocytes. Again, or even the platelets, this one is absent. So in the blood cells, among our blood cells, your M and the N could only be found in our RBC membrane. But the M and the N antigens could eventually also be found in other tissues in our body, like your renal epithelium and your renal endothelium. Okay, now we go to your antibodies. So, we speak about here the different blood group antibodies, you need to, pinaka-important dito, you need first to identify if that antibody is an IgM antibody or IgG antibody. So, pag IgM antibody is a cold reacting antibody, that one is saline reacting, is not a clinically significant antibody. So, we consider that one as clinically significant antibody if that one is an IgG antibody, and that one is reactive at 37 degrees Celsius. We'll also need to identify ang mga blood groups natin here in terms of the activity of your enzymes. So, with the activity of your enzyme treatment, we're talking about routine enzyme like trypsin, papain, bromelain. So, yun ang mga routine enzymes na tinatawag natin. So, again, as a review with your topics natin sa ating fundamentals with your mga enhancement media, with the effects of your potentiator, even your enzymes. So again, ang summary natin ay your DAFI and the MNS blood group system are destroyed by enzyme treatment. Whereas naman ang ating your RH kid, your PI Lewis Lutheran blood group system are eventually being enhanced by our enzyme treatment. So pag sinabing destroy, pa nag-add tayo ng routine blood banking enzyme, so before nagkaroon ng reaction, pagkakamagaan ng enzyme, then lalagyan mo ng enzyme. After that one, tinest mo ulit. Pag wala ng reaction or reactivity, nag-negative na siya, so mean to say it is being destroyed by your enzyme. On the other hand, pag nag-perform ka ng enzyme treatment, so before may nagkaroon ng reaction, so you are suspecting na may presence ng antibody. Okay, and then eventually, you try to perform the enzyme treatment, nag-add ka ng enzyme, tapos andun pa din, after the enzyme treatment, still reactive pa din ang ating antibody, blood group antibody, so mean to say that one is being enhanced by our enzyme treatment. So we need to differentiate that one. So first one, we have your anti-M antibody. Anti-M antibody is an IgM antibody. So this is not a clinically significant antibody. So this is also being destroyed here by our enzyme treatment. Okay, so anti-M is one of those blood group antibody wherein that one is reactive at a lower pH. Usually, most of our blood group antibodies, they tend to react at a pH of 6.5 to 7.5. But in the case of your anti-M antibodies, reactive here at a lower pH, lower than 6.5. Therefore, your serum sample here for detection of your anti-M antibody should be acidified. Pag-add ka ng 0.1 N-hydrochloric acid para maging reactive ang ating anti-M para ma-identify siya na ay itong sample ni patient ay may anti-M. But if the pH, for example, your medium, for example, hindi siya ganun ka-acid, or let's say more than 6.5, so kahit andun sa anti-M natin, it will not give a positive reaction, reactivity, and magiging negative ang ating reaction. So, ay, wala itong antibody. Okay, safe for blood transfusion, but actually meron siya. Only that, you need to enhance dapat with the acid na pH because this one is an acid-dependent na antibody, just in the case of your anti-M antibody. Okay, your anti-M and even your anti-N shows here dosage activity. So like for example, pag sinabing dosage activity, so ang antibody natin, they tend to be more reactive if your antigen, since antibody siya, your antibody is reactive here if your antigen is homozygous. So since your M and the N are antithetical partner to one another. So like for example, may anti-M ka, between this one genotype saka or phenotype, that one. So ang anti-M natin is much more reactive dito compared with dito. It's because dito, dalawa silang present, so okay, so nahahati ang kanyang reactions. And this one naman, so it tend to react for this one kasi isa lang siya ang ating antigen. Specific for M lang, wala kang N, so that would allow you then to have a greater reactivity. And therefore, we consider that one as property of your antibody showing here the dosage activity. On the next one, we have your anti-N antibodies. So anti-N antibodies, also an IgM antibody. So it's reactive at cold temperature, saline reacting, and that one is not clinically significant antibody just like your anti-M. Anti-N is also being destroyed by our enzyme treatment. Okay, there's a special type of anti-N, anti-NF. Okay, so this is that type of your anti-N antibodies being produced from patients undergoing dialysis where the equipment used during the dialysis treatment ng patient that has been exposed to your formaldehyde. Since nag-expose sa formaldehyde, nagiging immunogenic siya, antigenic, and the patient would have a tendency to develop an antibody directed towards that one, so that's why magiging anti-NF na siya. Okay, so that's for the M and for your N. Okay, now we go to your SS antigens or the SS blood group system. So, the bigger S, smaller S are also antithetical partner to one another. So, basically, so usually they are found here along with one another. So, unlike your M and the N, so the SS blood group system here could be found in our glycophrine B. The glycophrine B is much inner siya, medyo nasa loob siya compared with your glycophrine A. So, therefore, nakalagay sa PowerPoint natin is not destroyed by the enzyme, but actually it's being destroyed also by the enzyme treatment. Just like your M and the N, only that is hindi siya ganun ka nadi-destroy agad because medyo nasa loob siya. Compare with the M and the N wherein they are found in glycophrine A. Ang glycophrine A kasi natin nasa medyo sa labas talaga siya ng RBC membrane natin, so mas madali siya ma-destroy ng ating enzyme treatment. But still, your SS blood group system still destroyed by our enzyme treatment. As for your antibody, usually your S and the S blood group system here, they try to be found in coordination or found along with your U blood group system. So pag sinabing found along with your U blood group system here, so if ang patient natin may phenotype na SS negative, so usually U negative din siya. Same way, pag ang patient natin ay SS positive, S positive, the bigger S positive, smaller S positive, and U is also, U na antigen is also most likely positive din siya. Okay, so we have here the antibodies related to your S, anti-S, the bigger one, smaller one, are considered to be as our IgG antibodies. So being IgG antibodies, they are clinically significant antibody. They can fix the complement and eventually try to cause here your hemolytic transfusion reaction reactive at 37 degrees Celsius. Okay, we have here the U phenotype associated with your SS group system. So basically, again, okay, U stand here for the universal. So that would mean that majority of the population are U positive. So pag majority of the population are U positive, so wala tayong masyado makakita ng patient na may anti-U antibody. Again, ang rule natin dito ay pag ang patient natin ay positive na sa antigen dati, kahit salinin mo pa siya ng blood na negative for that antigen, hindi pa rin siya ma-expose, so hindi siya magde-develop ng antibody. But if the patient, for example, is negative previously for that particular blood group antigen, tapos na-expose siya because sinalinan mo ng blood na positive for that antigen, so that would only time na magde-develop siya ng antibody directed towards that blood group. Since your U blood group system, majority of the population are U positive, so wala masyadong makikita na anti-U antibody. It's because konti lang patient na negative for the U. So since konti lang ang negative na U, so wala ka masyadong makitang patient na may anti-U antibody. Okay, so except here 1% of your American blacks, which are U positive, U negative, and 135% of your African black. So dito ka makakita ng ating, so 1% lang ang African black natin ang negative for that. So 1% population na most likely ang may anti-U antibody. Or same true with this one. 135% lang population natin na makahanap ka ng anti-U antibody is because previously they are negative for the antigen. Okay, so for the type of the antibodies, one is an IgG antibody, anti-U antibody is an IgG antibody, and therefore that one is clinically significant antibody, try to cause hemolytic transfusion reaction. Then we have also here the Milton-Berger series. So this blood group here would have presence of the low incidence antigen. So pag low incident antigen, so wala masyado tayong makakita ng, okay, eventually pag low incidence, so negligible ito. So pag low incidence, so wala masyadong pasyente na may ganitong klaseng blood group. Okay, this one is also purely serologic lang din. So you can identify that one by serological typing. But then again, hindi naman kasi siya clinically significant. So, why bother to identify that one in the routine na antibody panel identification or even your phenotypic typing? Diba? So, hayaan mo nila kasi low incident antigen lang naman siya. Okay, now we go to the next blood group system. We have here the P blood group system. The P blood group system has been designated by 003 ISBT classification number. So we have here different phenotype related to your P blood group system. So this includes here your P1. So the P1 contains the following antigens. Meron siyang P1, the P, and we have the PK na antigens. Since lahat siya merong antigen, do not expect na magkakaroon siya ng antibodies. The P2 on the other hand contains here your P and the PK na antigen, so wala siyang P1, so therefore makakapag-develop siya ng anti-P1 antibody. Then we have also here the P null, P smaller p, and the null, mean to say wala talaga siyang antigen. So anong antibody natin? Therefore, we are expecting that one, the patient could develop here the different, all types of your P antibodies, anti-P, anti-P1, PK. Anti-PP1 PK antibody, also called here the anti-TGA. So we're going to discuss it later on. So from Mrs. J, that's why nga tinawag siyang anti-TGA. Another phenotype, P1K, this contains the P1 antigen. So therefore, ang kanyang antibody yung natira, anti-P sa anti-PK. P2K, so ito lang kanyang antigen PK. So therefore, ito wala siya. So magde-develop siya anti-P1, wala din siyang P. So it could have you the tendency to develop anti-P na antibody. Okay, now we go to the antigens related to your P blood group system. Okay, so the antigen here is eventually poorly developed at birth, and most likely it's being produced only here after 12 weeks of the life of the baby. And that one would be able to have your full strength expression of the antigen on the 7 years. Okay, so we have here the different antigen P1, P, and the PK. Again, this one could be found here not only in your blood cells, di ba? Ang MN natin, nasa RBC lang siya. Ito, aside from your RBC, they could also be found in other blood cells or body, including your lymphocyte, granulocytes, monocytes, and even your platelets. Your P naman could be found here in your platelets, epithelial cells, and even your fibroblasts. The PK, usually they're found with your in the plasmas or glycosphingolipids na chemical composition. But when they are derived from your hydatid cyst is your Echinococcus granulosus na parasite, diba? So, if that one has been extracted from your Echinococcus granulosus, your P na blood group system here na antigens, the P and the PK, they are the structure, composition of that, the chemical composition of that, instead the usual na glycosphingolipids, glycoprotein siya on your Echinococcus granulosus or your hydatid cyst. So, pwede din natin makuha ang ating P antigens from the different parasite infection. Like, for example, your Echinococcus granulosus, your hydatid cyst, hydatid sand na tinatawag. You have your droppings of your pigeons and turtle doves, egg white of the turtle doves. Would also be derived here from your Fasciolopsis, Clonorchis, Opistorchis, Lubricoides terrestris, and we have your Ascarisuum. And therefore, since ang sources nila ay mga ito, your antibody could also be neutralized by the following sources. So pag like if you have anti-P antibody, so pwede siya ma-neutralize ng mga ito kasi may mga P antigens sa mga ito. Okay, now we go to the antibodies related to your P blood group system. The first one, we have your anti-P1 antibody. Anti-P1 antibody is an IgM antibody, and this one could be neutralized by your P1 substances. Again, our P1 substances, this includes here your the one that could be harvested from your hydatid cyst, your Echinococcus granulosus, your Opistorchis, mga ganon. Those are your P1 substance. So, if you have that one, mga substances from your hydatid cyst, Echinococcus granulosus, and many others na kanina na nakalist sa atin, and then the patient would have your anti-P1, so it could neutralize that one by addition of your P1 substance. Okay, as for the reactions here with the enzyme treatment, your P blood group system or the antibody related to your P blood group is eventually being enhanced by our enzyme treatment. So again, your M and the N, the SS are being destroyed by our enzyme treatment. But for your P blood group system, that one is being enhanced by our enzyme treatment. So this your anti-P1 is an IgM antibody, it's cold reacting antibody. All the rest ng mga anti-P antibody here, they are considered to be an IgG antibody. So they most likely they are active at colder temperature, 37 degrees Celsius. The first one, anti-PP1PK antibody. So, ang magproduce lang nito ang ating P-null na patient. Yung P-null na patient, wala siyang P antigens sa kaninang sa table natin. And therefore, the patient would have the tendency to develop an antibodies to all of your P substances or P antigens. And therefore, meron siya anti-PP1PK. And basically, this one is, but anyway, yung anti-PP1PK, hindi ito individual na P1, P, and the PK because they have identified na hindi nila pwede i-breakdown ito. Okay, so this one has been identified. Other name for this one is your anti-TJA. So this is the antibody produced by Mrs. J. Mrs. J would have here adenocarcinoma or cancer. And from there has been extracted this antibody. Okay, this eventually this one tried to cause here spontaneous abortion. And this one is an IgG antibody. And the next one, we have your allo anti-P antibody. So it's also an IgG antibody. This one is associated with causing here your early, okay, habitual early abortion. The next one, we have your auto-anti-P is an auto-antibody produced primarily by patient with your PCH or paroxysmal cold hemoglobinuria. Okay, so that one, paroxysmal cold hemoglobinuria here would be produced by the patient with auto-anti-P antibody or patient with a paroxysmal cold hemoglobinuria produces an auto-anti-P antibody. And this one produces here biphasic na hemolysin. You call that one your hemolysin as your Donat-Landsteiner. And pag sinabing hemolysin, so this is an antibody. This one is an antibody, which is a type of hemolysin which try to lyse the red blood cells. So that's what's being called here as your biphasic because it tend to react into temperature. First, it try to bind with the RBC membrane on the cold temperature. Okay, but then eventually it try to cause here hemolytic reactions or lysis of the RBC when they are exposed in another temperature, which is 37 degrees Celsius, which is much hotter compared with your RBC here upon binding of this antibody in the RBC or attachment of that's occurring in a cold temperature. So at a cold temperature, this antibody or antibody will bind with the RBC membrane. Tapos pa na-expose ang ating RBC at 37 degrees Celsius, try to cause lysis on the temperature. So from cold temperature to a hotter temperature, that's why it's called here a biphasic na hemolysin. Okay, now we go to your eye blood group system. So this includes here the bigger eye and the smaller eye blood group system. That's one is being designated by the ISBT classification number 027 na ISBT classification number. So we have here different phenotype related to your eye blood group system. So we have here your adult eye, the bigger eye, cord eye, the smaller eye, and adult eye. Okay, so basically this one, nasa pag-infant, pag-baby yung patient natin, pero pag lumaki tayo, natatransform siya to become here the bigger eye. Okay, how would you know here what is present na antibody sa patient natin? Then gagawa tayo ng reaction here with the corresponding na anti-sera. So, anti-sera, anti-eye, the bigger eye, anti-eye, anti-sera, smaller eye, and we have also here anti-sera, anti-IT. So, if what is present in your patients, for example, na red cell membrane niya is the adult eye, so this one would have here reactive at this one, anti-sera, because this one's a bigger eye. And for the anti-sera and anti-eye, smaller eye, and anti-IT, it would have here a weaker expression because nasa adult naman kasi siya. Cord eye, the smaller eye, so obvious naman siya, so it will be reactive on this anti-sera, anti-eye smaller, saka anti-IT, but not anti-eye na bigger na eye. For adult eye, so this one, since adult na siya, dapat, what you have here, na-transform na siya dapat to become your bigger eye. This one would be reactive here strongly at your anti-eye na anti-sera. Weak dito sa anti-eye na bigger eye, but here in the anti-IT, we'll have here a weakest na reactivity. Okay, then we have here the I antigen. So the I stands for your individuality. Okay, so at birth, what you have is a smaller I, but as try to grow older, that will be converted here to your bigger I. That's why we consider the antigen here as poorly developed at birth, because at birth, what you have is just a smaller I, and eventually magiging bigger I siya. Okay, so after that time, so most likely, you are producing here your transformation of your eye to become bigger eye in the 18th weeks. Okay, then another one, this eye antigen here could be found not only in the RBC membrane, but on other blood cells of your body, including your WBC, and we have also here your platelets. Okay, then we have also here the antibodies related to your eye blood group system. The first one, we have the anti-eye, the bigger anti-eye. So this one is an IgM antibody. So it's related to your CAD or cold agglutinin disease. So kanina, di ba, your auto-anti-P is related to your PCH, paroxysmal cold hemoglobinuria. Although this one's cold temperature, but that time antibody for that is an IgG antibody, which is your cold hemolysis, biphasic na hemolysin. But in case of your anti-I na antibody, this one is an IgM antibody. And this one is associated here with your cold agglutinin disease. And also, the patient could also develop this antibody once they are being infected by your Mycoplasma pneumoniae. Okay, so that's your primary atypical pneumonia. Primary atypical pneumonia. So your Mycoplasma pneumonia here would eventually try to produce here para siyang eye-like substance. And therefore, once a patient got infected by that na caused here by Mycoplasma pneumoniae, that would eventually try to produce here anti-eye antibody, which is the bigger eye. Then we have here the anti-eye, the smaller eye. This one is associated with your IM or your infectious mononucleosis. Anti-IT, on the other hand, is related to your Hodgkin lymphoma. Then we have your anti-eye phenotype, the smaller eye, associated with the congenital cataract formation among Asians.